for prostate cancer, and there's a lot of treatments out there. Radiation, surgery, focal therapies, and there are pros and cons to each one. The side effects that most men are concerned about, functional side effects, are urinary incontinence, especially stress incontinence, but could also be urgency incontinence, as well as erectile dysfunction. And the prevailing thought is if I have surgery, I'm going to be impotent, I'm going to be incontinent, and that's not necessarily true. Proper nerve preservation, adequate urethral length, urethral preservation can really significantly improve a man's functional outcomes after surgery, in addition to removing the cancer entirely. Radiation and focal therapies have been touted as options for men who want to preserve their erectile function and their continence by avoiding injury to the nerves that surround, like a hammock, the prostate, and by avoiding injury to the sphincter mechanism that maintains continence. And while that can be true, a caveat is the way radiation works is that it causes, imagine like a global ischemia. It's really not just killing prostate cancer cells, but really targeting all the cells that are sitting in and around the prostate. And that includes blood vessels and nerves too. So while you might not get immediate ED or incontinence, over time, and I'm saying 5-10 years out, you will get maybe some urgency incontinence. You can also see stress incontinence, and you can develop erectile dysfunction over time. So if you are a young man, let's say you've been diagnosed in your 50s or even early 60s, and you opt for radiation, you have the next 20-30 years of your life to potentially experience those functional side effects. Right? So you can't avoid it with radiation. And radiation also has some other, upfront side effects. It can cause blood in your urine, also known as hematuria. You can have blood in your stool or in your poop. It can cause, bladder urgency. It can cause all sorts of irritation to the bowel as well surrounding the prostate. So there are side effects that need to be discussed with the patient regarding upfront and long-term side effects of radiation. Focal therapy is another option that's been touted to preserve both erectile function and continence results. The one thing you have to keep in mind with focal therapy is that prostate cancer is not often just localized in one place, right? So it can be multifocal. You can have many different areas of prostate cancer within the prostate. So there is a possibility that when treated with focal therapy, whether that's cryoablation, whether that's HIFU, whether that's TULSA-PRO, there's so many things out there, you're targeting what you suspect is a suspicious lesion based on either biopsy or MRI, but there's potentially occult cancer elsewhere in the prostate that's not being treated. And that can progress, that can spread, and now you're, sort of targeting multiple areas in the prostate, and you're sort of chasing rather than treating up front. And there is a risk of recurrence in that case. Additionally, if you have radiation or focal therapy, if you exhaust those treatment options, the next step would potentially be surgery and doing what's known as a salvage prostatectomy, which means a prostatectomy after radiation or focal therapy, is significantly more challenging. There's a lot more scarring. The tissue planes are a lot more stuck, so the risk of collateral damage, and that includes erectile dysfunction, that includes urinary incontinence, but that can include things like even rectal injuries that much higher if you do a prostatectomy after prior radiation or focal therapy. So that's something patients need to be aware of if they don't do surgery up front and they want to elect some of those other options. Should they have a recurrence, then the risks of the surgery are higher.